My name's Jasmin Orange. I am an assistant nurse manager in a medical intensive care unit at Christiana Care in Delaware. I think anyone could look at the news and kind of get the sense that workplace violence against healthcare workers is on the rise. It's an epidemic within our field, and it's really something that's going to take a big team and a strong voice to combat. AACN is, as an advocacy group for nursing, is a great place to start that. The more I've learned about workplace violence and the impact that it has on those that I work alongside, the more driven I am to combat it, to fight it, and find a way for us to end up on the other side where nursing isn't a profession that thinks it's okay to get hurt at work. Workplace violence screening tool that we're using in my institution is called the DASA, the Dynamic Appraisal of Situational Aggression. That tool screens patients based on 7 behaviors that the nurse assesses as either present or absent. If there is more than 3 of these behaviors present, then the patient is at high risk for aggression. I think when nurses identify that their patient's behavior is escalating, it's important to recognize that, first of all, and say, what can you do to kind of mitigate this risk? So mentoring our new nurses, having them come in the room with us when we're having those conversations. For me, it was going into the room with our intensivists when they're having those end of life conversations that I really learned how to connect with families, how to tie in what is important to them to the care that we're providing. I think AACN is doing a great job of promoting workplace safety by having a platform like this, coming to the session, seeing the people that were there and wanted to talk and engage about what they're doing at their institutions for workplace violence. It's the same, it's just that collective voice of nurses that we can learn so much from each other and what other practice areas are doing. So AACN providing conferences where we can talk and exchange ideas is a great way.